We welcome you back to the Means Report, everybody. So happy that you're staying with us on this Sunday, and my thanks again to little Maddie. Didn't she do great? We had all sorts of distractions for her, and I guess they paid off because that was a pretty peaceful segment. We want to shed some more perspective on congenital heart defects, what happens to the young heart once a defect or issue is diagnosed and detected. And to help us down that path, we're going to turn to Dr. Reginald Pilcher. Dr. Pilcher is a pediatrician at Doctors Hospital, a busy man, a popular man. I know a lot of you know him and appreciate his work. And Dr. Pilcher, we're glad you're here. Thanks.
Well, it's my pleasure to be here and to answer questions concerning heart disease, which of course is a major concern for most parents when they hear the word.
Well, it is, and I know that we talked about something a moment ago and it resonated with me because as a new parent, I remember hearing this word, and that word is murmur.
Right.
If a pediatrician says to you, your child, your baby, has a heart murmur, or I hear a murmur, you pretty much were saying that's not cause for great alarm. Why?
Correct. Well, 80% of children will have murmurs at some point in their life, and most of these are innocent murmurs.
Mm-hmm.
We call them physiologic murmurs or normal murmurs. Some murmurs are heard in infants that are actually innocent murmurs and will go away within a short time. So when we say the word murmur, actually what we're talking about, it's a turbulent flow through the heart. And if it's a normal murmur, it's a turbulent flow through the heart or adjacent blood vessels in a normal heart.
All right.
Also, a murmur can be caused by a congenital heart defect or some other types of heart defects.
Can I hear it if I put my ear to the baby's chest?
Possibly, if it's loud enough. We grade the murmurs 1 through 6, 1 being the softest sound, 6 being a sound you can almost hear if you're standing near the chest. So most murmurs are 2 to 3 that we hear that are these normal murmurs. We call them 2 to 3 over 6. And they, like I say, usually are short in duration. We give a quality to the murmur. And depending on where it's heard, the type of murmur, the loudness of the murmur, the quality of the murmur, we can ascertain whether we need to refer the patient to a cardiologist or not.
Yeah, I was going to ask you, is it duration that you're looking at when you determine whether you're going to make that referral? You know, the child has been having this murmur for 3, 4, 5 months, let's refer him or her. Is that how it works, or is it severity, or both?
Well, if it's a loud murmur, say it's a 4 over 6
Right.
with what we call a thrill in there, then we'll usually send these right away when we hear them. Or if they're having other symptoms along with the murmur, such as they've passed out,
Right.
They've had chest pain, they're not growing as well as they should, they seem to fatigue easily. These are things that kind of lead us to think that possibly something else is going on with the heart, and we'll refer these.
Our first guest was dealing with a missing chromosome, and that was the issue with her child's heart. What else can cause these defects? Is it just at some point during the gestation period that the heart just didn't come together right?
Right. That's usually the case. And there are many syndromes that go along with heart disease. Down syndrome is very prevalent, and it has many people with Down syndromes have heart conditions. But we do know that while the heart is developing, that for some reason the valves will not develop properly, or the arteries leaving from the heart, or the walls. One main defect we see is, and you hear the word hole in the heart.
That's right.
Well, the hole actually is between chambers of the heart. It's not a hole through the heart or anything, of course. It's holes within the heart between the chambers, and we call these ventricular septal defects or atrial septal defects. Many of these are literally take care of themselves. They can be repaired, but many will repair themselves through time. And we follow them, and the cardiologists will follow them.
How old might the child be when it repairs itself? Do they have to wait till they're grown-ups?
Sometimes they can seal within a few years.
Mm-hmm.
Sometimes we have had VSDs or ventricular septal defects seal within a year.
Wow.
So if they're a small opening. And most of the time with murmurs that have congenital defects in the structure of the heart, then they will be followed by the cardiologist until they're released to either until surgery takes place or the lesion repairs itself enough that they can be released. And there are other things that go with murmurs that parents, and I guess I want to, on this point of murmurs,
Sure.
when a physician tells a parent that their child has a murmur, it's usually a devastating blow
Right.
to the parent. The parent hears that word, they think something's wrong with my child's heart. But the key to the whole thing is the physician will be following it. Most of the time, almost always, nothing is wrong with the heart. They're hearing this sound. We certainly want to tell the parent and let them know in case some other physician should hear it, then their fears have been allayed, and then they will know how to answer that question. Yes, my pediatrician is following this or whatever. But most murmurs are innocent. They're harmless.
Well,
and we do get follow-up with cardiologists with murmurs that we possibly feel are probably innocent murmurs. But to allay the fears of the parents, we have often gotten workup with cardiologists. All pediatricians are guilty of this. I am myself. And but it is a devastating
well, better
thing.
safe than sorry.
I've seen the tears on the mother's face when I say this to them, your child has a murmur. In fact, this past week, your child has a murmur. But then the next 15 minutes is reassuring her that this murmur sounds normal, we're going to follow it, and your child's going to be fine.
Well, I think mom needs to realize too that she's in the majority at that point. You're
That's
talking
right.
8 out of 10.
That's right.
Is there a pill that the baby can take that'll fix this?
Usually not. In some cases, there may be, in certain congenital heart diseases, they may take certain things like beta blockers, blood pressure medicines to at least help the heart be more efficient. Digoxin is another thing. But most of the time it will not fix the lesion. It will make the child's heart pump better and the child to have less symptoms of fatigue and so on, and be able to grow better and all, until surgery possibly can be performed at later times.
Barring any chromosomal abnormality, what can mom do to make sure that the baby's heart is as healthy as possible when the child's born?
Well, of course, stay away from smoking,
Yeah.
cigarette smoking, absolutely. We don't know that it ties to it directly, but we know that cigarette smoking is harmful to children, even normal children without congenital heart disease. So smoking while pregnant, alcohol while pregnant, eating the right diets, exercising moderately, all of these things are and stay away from sick people. All of these things can help the mother have a good pregnancy and do as much as possible to make sure that her child is healthy and that the heart is healthy and that she'll have a normal baby.
Let's go back to our attempt to reassure people out there that all is going to be well and that this is a manageable issues of the child's heart. Take me through the young life of a child. After you see the baby with the heart problems, what kind of boy or girl does that child become usually with the proper treatment?
If they have a congenital heart disease,
Yeah.
well, of course, it depends on the type, but
Most cases.
heart problems, I will say this, but most of them have a normal life and a good life. And we're doing things today that were just, even when I was a resident 25 years ago, wasn't heard of. There was a child in my office day before yesterday who had a congenital heart problem, which when I was a resident was 100% fatal. The parents were told that the child would not make it if this were detected on sonogram prior to birth.
Wow.
And so this child was 6 years old, and there are people living now that are in their 20s with this same type heart defect that have been corrected. And she was normal and playful and shy and the regular things that all little girls are at 6 years of age. But the main thing is she was a normal, healthy child. And she had, in the past, what would have been a fatal heart condition. So
Isn't that amazing?
we've gone a long way.
Yeah, in such a short time.
It's amazing. And it is rewarding to watch these children grow and be healthy and be corrected.
I can't let you go without talking about the flu. Do we have it under control now with our children? Can we give them a shot still?
I would keep giving the shot as long as they last.
Yeah.
Many of the physicians are running out of them. The flu, this was a bad year. It was a very bad year.
Sure
and
was.
We have really pushed giving the flu shots. And we will continue to give the flu shots, as I said, as long as the vaccines last on into the spring, because we're not sure that we're not going to have another wave.
All right.
Right now, we had a wave that started back in October, which was very early for flu, and so now we're kind of hoping we do not have another wave, because it was a serious flu year. I had several people in the hospital with it. And we've seen quite a few sick children and parents.
All right.
And also, we've seen quite a few that got the flu shot and did get the flu, but the flu was much milder in these people.
So it's not too late to try to do something?
No.
Well, we appreciate it so much, not only for your interview with us today, but for what you do for the children of the CSRA. Dr. Reginald Pilcher, we appreciate it.
Been my pleasure.
Ours too. When we come back, it's time for our question of the week and how you can watch this and other editions of the Means Report. Stay with us.